So you decided to write a book about being a doctor who provides MAID. What was it that you wanted to say by writing a book?
Well, I wanted to contribute to the conversation. I think that people are really bad about talking about death and dying. I think people are not familiar, not comfortable with that conversation. I think that that's a shame. I think that death and dying are very unfortunately part of life. I mean, for me, it sounds paradoxical, but assisted dying, it seems to be about death and dying, but it's really a lot about living and how you want to live. And so I hope to contribute to that conversation.
Because you were one of the first, among the first providers in Canada who said, this is my calling. This is what I want to help people do.
Yeah.
Why?
For me, I've always been a caregiver of some sort. I do think that for me personally, I take pride and pleasure in helping other people. That's something I've learned about myself. And so I've really enjoyed my career. I like helping people. I like helping people through difficult and challenging times. I think I learned through my maternity years, as odd as it sounds, the more challenging the case, the social situation, the medical complications, the more I wanted to help. And so I guess in some way I was called to the challenge, maybe. I've never really thought about it that way, but I think I was up for the challenge. And I wanted to see if there was something I could do, and I found that I could do it, and so I got more involved.
Because a lot of physicians that I've spoken to with the prospect of doing medically assisted death, it was a very firm no thank you, not getting involved.
Yeah.
Yeah.
I think there's a bit of fear. There's a bit of unknowing. I mean, we are all very hesitant when we don't know or don't understand. And I did a lot of early work to just educate myself about it. It's not like I jumped in with glee. I mean, I didn't know what it would be like. I was quite fortunate in that I went to a conference, the World Federation of Right to Die Societies held a conference they do every 2 years internationally. There happened to be one in Amsterdam in 2016 in May. Coincidentally, 1 month before our law was going to change, I was already thinking of doing this work, not 100% settled, but really curious about it. And I had this opportunity to go there, and I think it was really confirming for me.
Do you remember your first assisted death?
Oh, I'll never forget my first assisted death. I hardly will forget any of them, to be honest, but of course my first is a standout. And I write about it in my book, and I call him Harvey in the book. And Harvey was very much a self-made man who knew exactly what he wanted. He had spent his life building what he wanted and creating family around him. For me, the most striking element of that experience is Harvey's death, right? I mean, that moment was the first time I'd witnessed this in this manner. And I was blown away at how supportive they were and how they all wanted to be touching him. They were all physically touching him. So I didn't direct them to do this. This was a natural instinct for this family. They're all touching him. They're all telling him they love him. They're whispering words to him. He's forehead to forehead with his wife. It was engrossing. It was mesmerizing.
Yeah.
I was blown away.
Have you ever cried?
Sure, I'm human. There's, there are cases where it's impossible for me not to project myself or my family into the situation. Sometimes it just hits home. There's someone who reminds you of yourself or your sibling or your child or your spouse, and it just seems too familiar. And you can't help but imagine what it would be like. Sometimes it's an exercise I get, on my way home in the car, I think about what would I want, what would I have done, what was beautiful about that, what was terrifying about that, and I think about it. But sometimes I don't have the luxury of that. I don't have that distance. It just hits me.
Some people think doctors are supposed to save lives, period.
Yeah.
That is a doctor's job, is to help a person stay alive.
Well, I think that's a fallacy. I mean, anybody who believes this doesn't really know what a doctor does. I mean, a doctor's job is to help people. We go into medicine because we want to help people. There are times when we can diagnose problems and times when we can even treat them and sometimes cure them. But that is not the bulk of what we do. I mean, I suppose some physicians, depending on their field, maybe do that a lot. But, I'm a family physician. I see people from birth to death and that huge roller coaster and twists and turns of life in between.
Do you sense, though, a stigma against doctors who perform MAID?
I haven't personally felt that, luckily, but I do know colleagues who have felt that across the country. For sure, there are physicians who feel stigmatized because they do this work.
Does that bother you? Have you ever been targeted in any way?
I hesitate to say that doesn't bother me. I made a conscious decision when I started doing this work that I would do it openly and publicly and transparently for the purpose that I think this is legal medical care in this country. It should be treated as such. There's nothing clandestine about what I do. It should not be done behind closed doors or in secret.
Okay, so I think that would also be part of the motivation for doing the book.
Certainly.
It's like, here is what I do.
Absolutely. Pull the curtain back. Here is what I do. Lots of misinformation. Let's correct that. And by the way, we shouldn't be scared to talk about this. This is not just legitimate, but I think a valuable extra tool at end of life. It's not a tool that many people choose, despite all the headlines. You know, across Canada, only 2.5% of all deaths annually are attributed to an assisted death. Mm-hmm. This is a very small amount of people, but that doesn't mean it shouldn't be available or we shouldn't talk about it. People should know about this.
The rest of Canada is at 2.5%, and Vancouver Island is at 7.5%. And across the country, people's eyebrows go up
when they hear that.
When they hear 7.5%.
Sure. Yeah. Well,
is this a role model? Is this a role model region, or?
I think we're a unique region. I think I don't expect the rest of the country to come up and match this level. I think we are special in certain ways. I mean, I don't have evidence for this, but I can tell you what I think. I've thought a lot about this. I think that, well, first of all, our demographic is a little bit older. We have a warmer climate, so we have a retirement community here, and MAID tends to be requested by people who are older. Average age is about 75, so just basic demographics is one thing. Number two, we're not just a retirement community, but people choose to come here from a lot of Western Canada. And these are often people who've been successful in other provinces, who've had independent lives, have made themselves successful in certain ways, determined. That is the most likely type of person who's going to request MAID, someone who has thought about this and what they want in their later years. I think we also have a health authority here. We have one health authority that runs the entire region, so we're not divided into many jurisdictions. A health authority that, for all the good and bad that they do, and we can talk about, they did not wait for the law to change to start thinking about this. They saw the law changing, they saw the change coming, they prepared in a proactive way so that when the law changed, we were ready to go.
So doesn't that make Vancouver Island a Canadian leader?
I think in terms of accessibility to MAID, I think that makes Vancouver Island a leader in Canada. Yes.
Internationally?
Well, our numbers are very high internationally, so I think so, yes. We have a model of care here that is facilitating access and high quality care with the supports we need to make that work. So, yes.
Some people wonder if it's a red flag.
Yes, I'm sure some people do consider that. I think the other thing I didn't mention about Vancouver Island and the West Coast in general, we're not known for our conservative politics or thinking. We have more progressive attitudes, and there are people here that are a little independent-minded, a little bit different than some in central Canada. I mean, I think there's a lot of factors that have made us unique. Like I said, I don't think the rest of Canada is going to come up and match this number. I think there's a lot of factors very specific to this region that all come together.
But would it warrant some research to see what it is you're doing right and how you're doing it, and are you satisfying your population in a way that other regions are not?
I would say that we are doing something right. I think that it would be really interesting to research what has worked well here.
Do you ever feel like you're going to burn out, witnessing death after death after death?
So that was a concern at the beginning. Certainly my colleagues in Europe were very vocal about the caution that anybody who does this should take, to take time off after every event, to make sure that I had colleagues and loved ones I could speak to, that make sure I had the supports I needed. And I was quite cautious in the first couple months. I didn't find that to be my experience. And I don't think I'm alone in that. I have certainly spoken to my colleagues across the country. There is early qualitative data showing that those of us who do this work have found it to be, well, we found it profoundly meaningful work. We feel a lot of gratitude from our patients. We feel a lot of gratitude from their families. It is moving. It is extraordinary, it is meaningful, and so I don't feel burnt out. When I leave the home of someone I've helped, of course I'm sad. Somebody's life has just ended. It can be tragic depending on the circumstances. But I feel like I helped facilitate their final wish. I feel like I gave them a gift. I feel like I helped them, get what they needed, what they wanted, what they really asked me for. And to be able to offer that to someone, that doesn't feel bad.
Yeah. So you are trying to educate, expand, and get some consistency with the education.
Yes. So
how important is that to you?
It's incredibly important to me. One of the main goals of CAMAP is to help standardize care across the country, so a Haligonian in Halifax who wants to have MAID, who has a certain diagnosis and wants to seek an assessment, is treated with the same type of approach and expertise as someone in Manitoba or British Columbia. I think that's essential. Where that might not have been true in the past, I think it's getting better. Currently we're actually developing and producing a fully accredited national MAID training program. So any clinician who's interested in doing this work will have access, online, offline, English and French, to access high quality, evidence-based MAID training education. And I think that will go a long way to first ease the fear, also to provide an approach to patients, both track 1 and track 2, to create a community of practice where there's support for people who are doing this work to network with each other, to learn and grow with each other, which is what we're doing now, and ultimately to standardize the care across the country.
How do you feel when you know that patient might shop their case around till they find a MAID provider who says yes? Is that a problem?
I actually don't think it's as big a problem as people might suspect. I am quite comfortable with my skill level. I feel like an experienced practitioner of this care, and I have no problems following my own understanding of the rules, the eligibility criteria of the law. I think if I feel someone is not eligible, I will say so. I think if there's a colleague somewhere else who feels differently, then maybe I have something to learn. Or maybe they have something to learn. I'm not sure which it is. I'm not scared of or shy of other opinions. I think we're all constantly learning. I think the implication is that someone will simply shop around until they find someone who says yes. I don't know of anyone who does this casually. I don't know of anyone who just say, oh yeah, sure, sign it off, let it happen. That just doesn't happen. That's a fallacy. And I think that if 1 or 2 people have already said no to a patient, they're likely to run into other clinicians who are also going to say no to them. There's a reason. Nobody wants to say no.
How do we know? I mean, like when you get a patient, you don't know how many times that patient might have been told no before you get them.
Well, the good news is there's one law, and there's one set of eligibility criteria. And if they meet it, they meet it, and if they don't, they don't. So that doesn't really change, no matter how many times they ask.
It still feels to me like this is a new profession in its infancy.
I wouldn't disagree with you. It's still in its infancy, but we do get an annual report from Health Canada with that data.
And now we're going to expand it most likely to mental illness, which is next year. Mm-hmm. Are we ready for this? I mean, it seems to me we're still trying as a country to grapple, to deal with this.
It's a good question. I think the issue of mental health patients accessing MAID is a very complex one. And I don't know that we have all the answers about how to do that properly yet. I'm eagerly looking forward to the report from the expert panel that's due out any moment now. I'll tell you, this may not be very popular, but I think we're doing it backwards in Canada. I think the Canadian public has said very loudly that the number one concern for them is they want to have what we call advanced requests for MAID, the possibility of saying at a certain point with a diagnosis, maybe dementia or something, when A, B, and C are true, I would like to have an assisted death. That's called an advanced request, and that is not currently legal in this country. And there's a very strong majority of Canadians that want that. I think that's a conversation we should be having perhaps first.
I just have a last question. How has this changed you as a person?
I allow myself to be more reflective about my own life. When something strikes me, or if I find it emotional, or if I'm, mesmerized by something, I'm more likely now to think about why that is, and to try to seek out what it is in my own life that is like that, or not like that, or I want to be like that, or I don't want to be like that. I'm a little bit more self-reflective, and I am more likely to have a conversation with my loved ones. It's easy to say and hard to do. It's easy for me to sit here and say we should be talking about what makes our life meaningful and we should have these conversations with our loved ones. But let's be honest, it took me at least 3 years of working in this field before I had that conversation with my own partner, before I had that conversation with my own family. It's hard.
Does it make death, the concept of your own death, easier?
No, I don't think so. I think it's still something to grapple with. I mean, I guess I'm a little bit less scared of what it could look like because I've seen it. But I don't have the answers. I don't know what's on the other side. I still wonder what that is. I guess I'm more comfortable with the conversation and facilitating those conversations, but I still don't have the answers.